Time now for Countywide, a special presentation of Yavapai Broadcasting News. Join News Director Paul David and News Editor Philip Catalfamo as they talk with our community's leaders, newsmakers, and people in the know. You'll hear about the hot topics in Yavapai County that affect all our lives. And now here's today's Countywide.
Catalfamo, I'd like to thank you for joining me. On today's show, we're talking suicide prevention and resources, and I am joined today by Chair of the Suicide Prevention Coalition and Chief Clinical Officer at West Yavapai Guidance Clinic, Kelly Legler. Kelly, welcome to the program.
Thank you. Thank you for having me.
As we all know, suicide affects everyone and everyone anywhere. As I mentioned, you are the chair of the Suicide Prevention Coalition. So I thought we'd start with that. Why was that coalition formed?
Yeah, it was actually formed several years ago in collaboration with community partners out of response to an increase in suicides in Yavapai County. So it was really about how do we bring all of our community partners together, have the bigger discussion of what are the policies for law firms, for gas stations, for grocery stores, for mental health. What are the policies around and procedures around when somebody is struggling with thoughts of harming themselves or ending their life. And so to be able to put a group of community partners and citizens together to be able to have more of a voice in fighting this major problem was why it was created. We're kind of leading towards a different path now in terms of who's on the coalition, why are we on the coalition, what is your role on the coalition, and so we welcome anybody who's interested to contact us so we can have those conversations.
And that contact, their website is wygc.org, and their phone number for the office is 928-445-5211. Those are numbers that, like Kelly just said, if you want to join that coalition, those are your resources right there. Yavapai County, where do we sit statistically and nationwide with our suicide numbers?
Unfortunately, we are still 3 times higher than the national average, and those numbers are not getting any better. In June, we lost 8 people to suicide. In July, we lost 7. And these are just unacceptable rates. And so what we know about suicide and the struggles, especially right now with COVID, is that it's not getting any better.
And like you said, in June you lost 8 people, July you lost 7, and then, you just mentioned COVID. I mean, those are during the months of COVID. And honestly, how has COVID affected those numbers? I would assume just from your 2 examples right there, it would be quite a lot.
What's really scary is that we haven't seen the trends when we look research-wise, when we look at any time there's a pandemic or a natural disaster like 9/11, it takes a couple of months for it to really sit in, and for the impact of how this pandemic is impacting us all. So we had anticipated an increase in anxiety, people struggling with depression, thoughts of suicide. We had anticipated that in October and November, and we're seeing that surge now. And what I mean by that is what we know about suicide is it's the feeling of isolation, the feeling of I'm alone, and the feeling of burdensomeness. So, I'm a burden to the people that I love. And so with this pandemic, when people are losing their jobs, people are struggling with just the regular stressors of kids going back to school, wearing a mask in a grocery store, the politics, do I not wear a mask, do I wear a mask? All of these things that are leading to our stress is contributing to our mental health, whether we have the best case scenario or not, in terms of, I can homeschool, I can quit my job. That would be, best case scenario going through this, and our baseline is still elevated at those best case scenarios of stress that we're enduring. So it's a scary time.
And you see right there on your screen, if you are listening over the radio, we posted up the nationwide suicide prevention hotline, which is 1-800-273-8255. And, it must be very tough, like you mentioned, that feeling of isolation, especially being somewhat, I don't want to say forced because I feel like forced is a bit harsh, but advised to stay home when we're really in our COVID numbers, people being told to stay home, it was the best for them, and those people who feel that isolation having to almost stay in that isolation. I can't imagine what that mental toll must have been.
Yeah, and what's really concerning as well is the vast majority of people who are suffering with that isolation and burdensomeness are not reaching out for the support and the help. And so, some of that it's contributing to the stigma around mental health. And when do I reach out, and will I be judged, and what will happen, and what does this mean? So us having kind of that bigger discussion of normalizing the feelings that we're going through. Again, I just talked about somebody with a quote unquote best case scenario of they're not at risk of losing their home or their jobs or their vehicles. And there's still that level of, this is profound stress that people have not endured before. This is uncharted. And so in our lifetime. And so the stigma around mental health, not just mental illness, that continues to be the biggest challenge we face in fighting suicide.
And and obviously you can correct me if I'm wrong on this, but I would assume that statistically our numbers are leading more towards older people, more of the elderly population. And with COVID, it's got to be really hard when, your grandkids can't come by really as much as they used to, or your son or daughter or whoever your loved one may have been. They're sort of forced not to go see grandma or grandpa or your uncles or your father or whoever because they can't. They're too at risk. Would you? My next question was going to be who has been the most impacted by COVID, and I guess the follow-up to that be, what is it our elderly population here in Yavapai County?
Yeah, absolutely. Predominantly, it's it's the 45, 65. It's the seniors, the senior citizens who are struggling with this thought more than anything, and some of that comes back to that feeling of being a burden, feeling of isolation. When we talk about maybe the lower end of that in terms of the 40s, it's the males, the late 40s. It's the males who are struggling with it, and we think of that need to be able to provide for the family, and that feeling of, with COVID right now, there's so much that's out of our control that we can't change. And so to know that we might not know where our next meal comes from, where we don't know where we're going to get the money to pay all of our bills, so we have to pick and choose. Is it electricity? Is it food on the table? I mean, these are real examples of our neighbors that are struggling, of ourselves that are struggling with some of these stressors, and it's absolutely contributing to feeling of anxiety, which leads to feeling of depression, which then leads to feeling of suicide.
Kelly, we've got 2 minutes. How can people check up on their loved ones during COVID? I know that our numbers are being, they're showing a nice rebound here in Arizona. We've had great COVID numbers recently, but how can people check up on their loved ones during this very, very weird time?
Go back to a telephone call, a Zoom, whatever it takes, reach out, trust your gut in terms of initiating that conversation. What does that conversation look like? Are you worried? Ask the questions, the tough questions, even if you're not quite sure what to do with what the answer is. Get outside of your comfort zone and go back to just being a human being, connecting with another human being.
Again, the West Yavapai Guidance Clinic's website is wygc.org. Their phone number 928-445-5211. Their crisis hotline 928-445-5211, extension 3900. Kelly, we're going to take a break, but when we come back, we're going to talk about suicide prevention and what you can do to help those who may be having suicidal thoughts. When we come back, Countywide will be right back. Don't go anywhere.
Starting in the late 1920s, Grandpa Gettle and his brothers laid the groundwork for what would become a family legacy. Almost 100 years and 100 patents later, Gettle's High Desert Mechanical continues to raise the bar of quality heating, cooling, and plumbing products and services in the Verde Valley.
Call Gettle's High Desert Mechanical Heating, Air Conditioning, and Plumbing at 567-2200 or online at GettlesHDM.com, providing solutions for your comfort. Don't settle. Get Gettles.
Hi, this is Greg at Verde Solar Power. Arizona has lots of clean, renewable sunshine, and we want to help you take advantage of it with our quality solar installations, and we offer to beat any written offer on a residential solar electric system. So bring us your electric bill and let us show you how solar power will save you money. We're located conveniently here in the Verde Valley and are dedicated to helping the valley go solar. So remember, the energy solution comes up every morning.
So I just moved in with this family, and it's embarrassing. The little one, he likes to go outside and crawl around in the giant litter box. I don't know what he's doing. I mean, I was born and I knew how to use the litter box. Look at that. That's disgusting. Oh, poop already. You're making me nervous. Oh, okay, I can't look at this anymore. I really hope he grows out of this, for his sake.
Orkin has pest control down to a science.
When your business chooses Orkin's Precision Protection Program, you get a tailored pest control program for your specific industry and environment.
Your business can benefit from over a century of experience, training, and scientific knowledge that define the Orkin man.
Maximum protection, minimum exposure, backed by one of the industry's most comprehensive guarantees.
Choose your locally owned and operated Northern Arizona Orkin and get more than an exterminator. Get an expert.
Welcome back to Countywide. I'm your host, Philip Catalfamo. On today's show, we are talking suicide prevention and resources, and I'm joined today by Chair of the Suicide Prevention Coalition and Chief Clinical Officer at West Yavapai Guidance Clinic, Kelly Legler. We spoke a little bit about statistics early on in the first segment. Now we're going to move on to suicide prevention. As we mentioned, here in Yavapai County, we are seeing a lot more of the elderly population dealing with suicide, but that doesn't mean that that's the only population that deals with it. Right now, Kelly, you and I spoke off air about how your son is going to school through Zoom, unable to go to the campus currently, but we're hoping that will change. How are kids affected right now with this delay in the school year?
Oh, so to put it in perspective, even before COVID, we had kids in Yavapai County as early as 2nd and 3rd grade that were contemplating suicide. So going into a pandemic, knowing that kids are hearing about, somehow this glorified idea of dying and coming back, because they're not able to conceptualize that. So you take the stress that was already there in this false notion of what death is, and you go into a pandemic where you see your parents stress. And from what studies are showing, it takes about a week to 2 weeks for kids to for the behaviors to show. So if I'm stressed this week, 1 to 2 weeks later, my son is going to experience I'm going to see the behaviors of his reaction to my stress. So, and then you take all these contributing factors of outside stress, of parents, of the world, of society, of kids having to wear masks in grocery stores, and then you put them in front of a computer where they have to learn, which is very different. It's different for the teachers, it's different for the kids. So we're contributing to isolation while we're adding to stress, while we're taking away their social development, while we're taking away their ability to feel that they have control over the way that they learn. And we're really setting them up for a high stressful, high reactive environment that unless we have the tools, unless the parents and the communities have the tools to be able to support them right away, we're not going to see the behaviors until they come out. We're not going to see the stress and the struggles until it comes out.
You said 2nd and 3rd graders are contemplating something like this?
These are stories that I know of personally. There might be some younger, but yeah, absolutely. And it's sickening to think that young.
That is a very, very adult thing to even conceptualize for a young kid, and that's a horrible statistic. You mentioned some of the warning signs, especially I guess now in that real younger population. What are some things that people really should be looking out for to get an idea as to where someone might be mentally?
Yeah, changes in behavior. Again, going back to trusting your gut. When I normalize it and I say be a human talking to another human being, it doesn't get more simple than that, and yet that's really complex. What does that mean? So trusting what you're seeing, what you're hearing, checking in, asking the question, are you feeling sad about not being able to see your family or your friends? Are you thinking of harming yourself, if the behaviors are that significant? Looking at just different changes in behavior. Suicide doesn't have a face. It doesn't have a socioeconomic status. It's not the rich or the poor. the young, the old, it's everybody. And so to really recognize that you don't know what other people are going through, you know what you're going through, and you can come from that baseline, but to really just ask the question.
You had brought up a good point before the show, and you had mentioned the difference between a mental illness and your overall mental health. Can we talk about those differences?
Yeah, I think with suicide, there's so many different avenues that we can go to, in terms of resources. There's there's 800 numbers, and we'll get into that later, I know, but when we talk about the idea of suicide and people struggling with suicide and what to do, it really comes back down to mental health. And when I say mental health, I don't mean mental illness. There's a difference between the two. Somebody that's struggling with a mental illness, that's kind of a diagnosable, that's schizophrenia, that's bipolar, that's major depression. These are kind of ongoing things that people were genetically, disposed to. They endured significant trauma. There's a lot of different reasons that people have serious mental illness that they're struggling with. Mental health, what I mean by mental health is ourselves from, so we have health care, and we think of our body. We think of good eating, of diet, nutrition. That contributes to our mental health. Our gut health contributes to how clear our memory is, how clear our ability is to be able to retain information, our executive functioning. So it's all about the stress, about what we do for our own self-care, what we do to recognize when we're feeling stressed, and how we can control that. Some people do yoga, some people read, some people go for a walk. That's mental health. That's contributing to your overall well-being.
I know that early on we had talked about some of the adverse effects of being isolated with COVID-19, but more regarding the mental health aspect of it, this could be a time for people to find a new hobby, or to find, like you mentioned, yoga. You can do yoga at home, or maybe start going, taking a trip around, jogging, is what I was going to say, jogging around your complex, or like you said, just cooking a good meal now that you're at home a lot more. Mental health is something I see a lot on social media, a lot of people pushing that sort of keep tabs on yourself, check to make sure that you're doing okay and that your own mental health is nice and stable.
Yeah, the way that I used to always train staff is the idea of you're on the airplane and the oxygen mask comes down and your infant child is right next to you, and every ounce of your body is telling you to put that oxygen mask on your child first. And the reality is you have to put it on you. You have to take care of you first. And so to think of that, how powerful that is, to remember that you can't help somebody unless you know where you are, and you're able to take care of yourself. And that's a pretty important lesson that's a lot of times easier reminded than actually practiced.
We just got a few seconds before we have to head to break, so I want to run through these resources as well one more time. Their website, wygc.org. Their phone number is 928-445-5211, and that is the West Yavapai Guidance Clinic. That was the phone number and website I just gave. The clinic's crisis hotline, 928-445-5211, extension 3900. And of course, both those phone numbers are on the website, again, wygc.com. The suicide prevention hotline, 1-800-273-8255. The biggest thing that we can take away from this is definitely you're not alone, and there are resources for you. But we're going to take a quick break. When we come back, we'll talk about some more of those resources right here on Countywide. Don't go anywhere.
From inspiration to installation.
If you need help with your decorating plan, call the pros at the Picture Window. We are your #1 source for top quality blinds, shades, shutters, and flooring. We've been in business here for 41 years, and our delightful sales staff has decades of experience. We're the locally awarded Best of the Best in both Sedona and the Verde Valley.
Don't pass up a free estimate on your project. Call the Picture Window now.
Paul Stanley here with Stanley Steel Structures. We offer shade structures that provide style, value, and performance. Our Equinox louvered roof opens and closes to give you the ultimate patio experience. We also offer Alumawood shade covers that looks like wood but lasts like steel and never needs painting or maintenance. Visit us at StanleySteelStructures.com. Contact us today and be covered tomorrow. Stanley Steel Structures. Let us add some space to your place.
Been hearing about the crazy benefits of CBD? Find out how CBD can help you at Sedona's #1 resource, CBD Sedona. Come in for a free consultation and let our trained medical staff help you find the perfect product for you. Pain-relieving salves, full-spectrum oils, honeys, teas, cookies, and even CBD for pets. Ready to feel fantastic? Come on by CBD Sedona today.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Me back here to Countywide. We are talking about suicide prevention and resources. I'm your host, Philip Catalfamo. I am joined by Chief Clinical Officer at West Yavapai Guidance Clinics, Kelly Legler. We talked about statistics in the first segment. We went into some of the preventative measures that you can go to for the second segment. And here, Kelly, I want to get through some resources and just one other question I have. I feel like a lot of people are worried to approach somebody about their suicidal thoughts. So I want to ask this. Can asking somebody increase the risk of them taking their lives?
Oh, that's such a dangerous myth, and I'm glad you brought it up. No, absolutely not. And it actually does just the opposite. If I'm struggling with suicide and I'm feeling like I'm a burden to somebody, it's ironically going to be just the opposite. My feeling of self-worth is going to increase exponentially if somebody takes the time and recognizes that I'm struggling with something deep enough for them to get out of their comfort zone and say, are you thinking of hurting yourself? Have you thought of killing yourself? And these are hard questions. So I certainly am not trying to minimize that. And when we ask, sometimes we're afraid of the answer. And that fear comes back to we don't know what to do with when they say yes. But by asking, you are saying that I care. I want to know, how serious is this? What can I do to help you? And by not asking, you're saying that whatever you're struggling with, I'm not seeing. And
are there any other misconceptions? I'm sorry, I didn't mean to interrupt you, but are there any other misconceptions regarding suicide prevention?
That is the most harmful. That is the most dangerous that I can think of. There's certainly misconceptions in terms of how to talk to somebody, being fearful of asking the question, being fearful of, taking them to go talk to somebody to help. But it all comes back to that main line of having that conversation with somebody, again, going back to that human component of talking.
Well, Kelly, we're coming down to just under a minute here. What resources and services are available at West Yavapai Guidance Clinic?
There's a lot of resources. We serve everywhere from birth to end of life. We have, a lot of primary care, psychiatric. We have hospitalization. We have skills training, counseling, everything that we can think of, because we really do look at the whole body and looking at, there's a lot in the world that we can't control. Really honing in on what we can control and what we can do differently, again, to increase our mental health and increase going back to the idea that everybody deserves to feel well, and increasing the likelihood that people will develop tools to get there.
Again, wygc.org is the West Yavapai Guidance Clinic's website. Their phone number, 928-445-5211. Their crisis hotline, 928-445-5211, extension 3900. Kelly, thank you very much for coming on. We have ran out of time, and I know there's still a lot more to talk about.
Yeah, thank you for having me. I appreciate it.
With that, I want to say that the suicide prevention hotline, 1-800-273-8255. If you are experiencing any sort of suicidal thoughts or are going through a lot right now, just know that there are resources for you. There are people who care about you, and there are other options than the final option. And with that, I want to say have a great rest of your day, and we'll talk to you again next time.